I encourage people to actually get a blood pressure monitor and to monitor their blood pressure at home. But I think just as important is making sure that you get the right blood pressure monitor. If you can't afford a blood pressure monitor, very nicely now, around most places you're going to be able to find a blood pressure machine in pharmacies or even in supermarkets where you can actually go in and get your blood pressure taken. But it's important to understand that there's several things that we have to look at when we look at home blood pressure monitoring. Number one is that the cuff has to fit. And when I say that, that means that the little band that goes around your arm has to be the right size. If you actually have too small of a cuff that goes around your arm, it will falsely elevate your blood pressure. So what you'll find is that, oh, my blood pressure is really, really high. But then when you go to your healthcare professional's office and they use the right size cuff, they're going to find that it's not as elevated. So number one is you have to make sure that that cuff is correct for your size. It doesn't matter the size of the cuff as long as it's the right size for you. The second is that we don't want to have a monitor that checks some small part of your body. So there's blood pressure monitors out there that actually check your finger or your wrist. These are very inaccurate, and I do not recommend them for any people. So if you have one of these, you should highly consider actually investing in one that goes around your arm. What you want to do is you want to find one that probably pumps up by itself, and then it's going to do that and give you a blood pressure reading by itself. These are a little more expensive, but they're very good, and they tend to be very accurate as far as getting home blood pressure monitoring. One of the most common mistakes we see with home blood pressure monitoring is actually the fact that we find that the blood pressures at home do not look anything like the blood pressures we're actually getting in the office. Now, this could be due to several things. One is it could be due to the fact that people get nervous when they come in to see the healthcare professional. Some people commonly call this white coat high blood pressure. But to be honest with you, if your blood pressure is elevated under this situation, many people think that it actually shows that your blood pressure will be elevated under other stressful situations as well. And it might be worthwhile to treat your high blood pressure in this situation. The other thing that often happens and why we get such a different reading from your home blood pressure to the blood pressure at the healthcare professionals is calibration. Remember that at your healthcare professional's office, they actually have to calibrate their equipment on a regular basis in order for it actually to work, number one, and for number two, it to be certified. So when you have a home blood pressure monitor, it's important to look at your monitor and see what kind of readings you're getting versus the ones at the healthcare professional. Well, how would you do that? Take it to the office. Take it to the office, wherever you're getting your blood pressure monitored, have them do it on their quote-unquote gold standard blood pressure monitor. What they're going to do is they're going to take the blood pressure, and then what you're going to do is wait maybe a couple of minutes and then take it on yours. What you're going to find is it might not be exactly the same, and that's okay. What you're going to find though is that it's going to be consistently different. So for example, then we're going to know that maybe on the top side of your blood pressure, your systolic, that your blood pressure monitor reads 5 millimeters different than the one that actually is the gold standard one, which is the healthcare professional one. Maybe the diastolic is 3 off. So, but just by knowing that, you now have confidence in knowing what your real blood pressure is, and we can better figure out if blood pressure medications or lifestyle or further lifestyle interventions have to be made in order to look at your home blood pressure versus the healthcare professional blood pressures that they're getting.